Scientists say there is a strong connection between this vitamin and cancer prevention, and something that the absence of this vitamin can in fact cause breast cancer. Modest vitamin D levels decrease the risk of cancer by 77%. It is a typical truth that vitamin D avoids various illness, including diabetes and heart disease. When it comes to cancer, vitamin D can be considered as the worst enemy of the deadly disease. A number of theories and over 200 epidemiological research study, the lack of vitamin D is associated with the advancement of breast cancer. Can vitamin D prevent breast cancer by 90%? Vitamin D has the power to avoid breast cancer, and this illness is typically called vitamin D deficiency syndrome. Nutrition, exercise, sleep, and stress management are also important in the avoidance of cancer. Carroll describes that 90% of breast cancer can be associated with the lack of vitamin D, which is 100% preventable, as verified by research. Vitamin D ruins breast cancer cells. Dr. Cedric F. Garland at the University of California's San Diego Moores Cancer Center is an epidemiologist, and he exposed the strong connection between cancer and vitamin D shortage. The medical professional explains that vitamin D damages epithelial cells in every type of breast cancers. E-cadherin keeps these cells together. It is a compound comprised of vitamin D and calcium. Vitamin D ruins these cells, and they can later increase, multiply, and develop into abnormal cancer cells. If you already have breast cancer, vitamin D can inhibit the growth of cancer cells with the aid of E-cadherin. When the growth is inhibited, the body immune system begins developing up, because it is not forced to deal with abnormal cancer cells. Increase the vitamin D intake to lower the danger of preterm birth by 50%. Vitamin D not only avoids cancer, it also benefits pregnant females. Science has actually shown that approximately 80% of all pregnant ladies lack this vitamin. Vitamin D likewise assists in dealing with many pregnancy-related problems. It minimizes the opportunities of having a C-section, as well as lowers the danger of low weight in newborns. Vitamin D in blood matters. The level of vitamin D in blood is an important aspect, because low serum levels increase your risk, regardless of your vitamin D intake. Do your blood evaluates routinely to keep healthy serum levels? The good idea is that practically all labs have actually enhanced their vitamin D tests. Do your vitamin D screening every 3 to 6 months, because the levels of this vitamin return to normal within 3 months after you have actually taken supplements or been exposed to some. You can also consume more foods rich in vitamin D. This includes salmon, herring, catfish, oysters, mackerel, and sardines. Take 1 to 3 teaspoons of cod liver oil to increase your vitamin D level. Please comment below and share this news. And feel free to sign up now for the News Exposed newsletter to get breaking exposed news, and more, delivered straight to your inbox. It's News Exposed signing off.